Moritz, thank you for taking the time to provide some insights of the work of the Group 3. Professor Moritz Kebschull from the University in Birmingham is chair of Working Group 3, which is about non-surgical therapy of peri-implantitis. So Moritz, about which therapies are we talking in this group?
So it's basically everything in non-surgical that includes all the different devices that could be mechanical, that could be physical, and a lot of the adjuncts, all these chemical agents that we could bring in or that a patient could bring in over time themselves. So if you're interested in what to use, whether to use a laser, whether to use an antibiotic, an antiseptic, or something to rinse, that would be the group for you.
Okay, so the EFP puts a lot of effort in this guidelines workshop, and you are a member of the EC, so please can you briefly comment of the importance of these guidelines for the EFP?
Yes, I think that's one of my pet projects, so I quite like this question, Bettina. The S3 guidelines are something that is world leading for the EFP because we combine an evidence appraisal with the combined clinical knowledge of a very large and diverse guideline group. And it is in industry independent format that has a lot of credibility, both methodologically and from the people involved, that has been shown to actually alter healthcare funding, that has been altering different regulations in different member countries. So we are working on getting perio and peri-related disciplines forward so that our members can treat our patients better.
So thank you for the insights, Moritz.
Thanks a lot. My pleasure.